Hello everyone, my name is Faiz Nadeem and today I'm going to be discussing in depth about what borderline personality disorder is, how to identify if someone is suffering from this disorder, some common misconceptions, and how best to treat it. Firstly, I hope everyone's doing well during this pandemic. I know how hard it is to stay at home all day, so I imagine it must feel the same for everyone else. But hopefully things will ease up soon enough. So let's get on with the topic. A few weeks or so ago, Dr. Huff made a video on Topic Masters with some instructions, where she discussed how borderline personality disorder, or BPD, is perhaps the saddest of all disorders listed on there. I didn't quite understand this fully when I saw the video, but as I did my research on BPD, I truly began to understand how hard it could be for someone who had this disorder. Um, Borderline personality disorder, simply put, is a mental health disorder that impacts the way you think and feel about yourself and others, causing problems functioning in everyday life. It includes self-image issues, difficulty managing emotions and behavior, and a pattern of unstable relationships. You have an intense fear of abandonment or instability, and you have difficulty being alone. You don't want to be alone, but you have a hard time trusting people. Inappropriate anger, impulsiveness, and frequent mood swings may push others away, even when you want to have lasting and loving relationships. BPD begins with early adulthood and gets worse as you reach young adulthood, but it can gradually get better with age. Although it is more common in women, it can affect both genders equally. Studies show that genetics and brain abnormalities have a huge role in causing this disorder in people. If someone in your family has this disorder, you're also likely to have it. We all know how important the prefrontal cortex is for our brain in social behavior, personality expression, and decision making. And having this disorder affects all those aspects of a person's life. Some research shows that brain chemicals such as serotonin that help regulate mood changes may not work properly, which could trigger impulsiveness in a person. This disorder can trigger anxieties and cause depression with constant stress over literally everything. Even if you're genetically prone to having BPD, it may never surface in you. Some other factors could also play a role in causing it. So if you were sexually or physically abused as a child, or lost a parent, or had some other traumatic experience as a child, chances are you would be more likely to succumb to disorder. Imagine being in a relationship with someone who is willing to help you with your disorder and stay with you no matter what, because they care about you so much, yet you feel as if they might leave you the next day. Because borderline personality disorder includes symptoms of erratic behavior and mood swings, it is difficult to tell it apart from bipolar disorder. In fact, coming into this project, I thought borderline personality disorder was just a fancy name for being bipolar. But after researching, I found out that BPD has a wider range of emotions, which one does not have control over, compared to the high versus low mood poles in bipolar disorder. They're almost the same thing, but there are some differences in there. The best way to diagnose someone with this disorder is a detailed interview with a mental health provider, as well as psychological evaluation, a complete check on one's medical history and exam, and an honest discussion about your signs and your symptoms that you may yourself be able to feel. This disorder can trigger anxieties and cause depression with constant stress over literally everything. All this can cause someone suffering from borderline personality disorder to constantly quit jobs, stay in and out of relationships, practice risky behaviors such as gambling, reckless driving, or substance abuse, and having constant suicidal thoughts in response to the fear of separation or rejection. Their opinions of other people can also change quickly. An individual who is seen as a friend one day might be considered as an enemy or traitor the next. These shifty feelings can lead to intense and unstable relationships. And then one thing I found out during research was that, like, normally in relationships, if someone has sudden mood swings or there are a few issues, turmoils, we feel pain and sadness. But these are only a small taste of what people with borderline personality disorder experience. You always live with a constant fear of rejection. There's a constant seesaw between love and hate, happy versus abusively angry, and thoughts about suicide. The person would go into self-harm by cutting themselves or swallowing pills as ways to cope with the stress. This would be someone with severe symptoms. And I truly picture myself having to cope with someone who had BPD with this severity. If someone I loved a lot was going through this, it would not just hurt them, but it would also hurt me, just seeing them in pain and agony. And life can become very challenging with the constant fear that your loved one might try to hurt themselves or abuse themselves somehow the moment you step out of the house. The best way to treat BPD is to firstly accept and be fully aware of your own condition, and then try to seek therapy. It is a common misconception that only dialectical behavior therapy is effective in treating BPD. However, a lot of other psychotherapies are extremely helpful as well. Dialectical behavior therapy is specifically designed just to treat borderline personality disorder, as it uses skills-based approach in teaching you how to manage your emotions, tolerate distress, and improve relationships. But there are other therapies that are equally as good. There aren't any FDA-approved medications for this disorder, but people try taking antidepressants and try to cope with the stress and anxiety that way. Some common misconceptions about this disorder are, number one, women or only women or mostly women have BPD. This is a myth, and it's pretty harmful because it can work towards preventing an accurate diagnosis in men, as well as stigmatizing women and mental illnesses. While BPD is more common in women, it is also fairly common in men. Number two, bad parenting is to blame for BPD. Although parenting can contribute to a child's mental health, there are a wide range of environmental and genetic factors that contribute just as much. Number three, people with BPD are unbearable. It can be extremely difficult living with someone in mental illnesses, especially as you watch them suffer. You may view their outbursts or crises or as selfish and out of control. People with BPD can be highly volatile, unstable, and in constant crisis, which is scary. But they can also be treated for their instability and learn to be more productive and happy in life. And then the last one, people with BPD are manipulative and only want attention. This is probably the worst one and can completely crush someone's will to live even if they don't have the disorder. Saying that someone is just doing it for attention is outright mean and can have negative consequences. Since this condition can surface in early teenage, this is another reason why we should discourage and prevent cyberbullying and just bullying in schools and in general. Even if one wasn't really suicidal or they were trying to communicate something through self-injury, that communication would still be legitimate and important. Most importantly, however, is that these feelings are legitimate and not done for attention. I hope I have explained in detail about how to identify symptoms for BPD and what we as decent people can do by trying to be nice to someone who may be displaying erratic behavior, or just trying to assure them that they can share their feelings with us. I would have loved to have given this presentation in class, but we try to make the best of what we get, right? And then just a quick FYI slide. These are some famous people um, that are considered to have shown symptoms of BPD. Marilyn Monroe, Angelina Jolie, and then Britney Spears. One of her wedding lasted 55 hours, and that too with her childhood sweetheart. So that's a clear US symptom. And then these are just my works cited. And then, anyways, thank you for listening, everyone. It was a pleasure being in class with Dr. Huff and everyone else. And if you have any questions about the topic, I know you can't ask me like this right now, but you can definitely send them to me in Canvas on inbox, and I'll be glad to answer.